Good afternoon, everyone. I'm Petra Wolfweiss, Director of the Membership Center for the Association of Municipalities of Ontario, and you are joining us for part 2 of our AMO OMHRA Human Resources Labor Relations webinar. With us today, we have a number of esteemed speakers, which I will quickly introduce and then hand over the discussion to the moderator. We have Jane Albright, who is our moderator and Commissioner of Human Resources and Citizen Service, Region of Waterloo. As well, Jane is President of OMHRA. We have Lori Bolton, who's also a member of the OMHRA Board of Directors and Director of Human Resources with the City of Orillia. Mark Ellis, Director of Human Resources for Halton Region. Monika Turner, my colleague, who's Director of Policy with AMO. And we have a number of folks from Hicks Morley joining us today to make sure we don't get in too much trouble and to provide the legal interpretation of many things you are facing today. We have Mark Mason, who's a partner with Hicks Morley, Stephanie Jeronimo, also a partner with Hicks Morley, Catherine Mean, who's a partner in the Kitchener-Waterloo office of Hicks Morley, and Amanda Cohen, who is an associate in a Toronto office, and Alexandra Majewski, also an associate in the Toronto office. Thank you for joining us today, and I think you will enjoy our panelist conversation with you.
Thank you, Petra. We have a very full agenda today, so we're glad that so many people were able to join us. We're going to be monitoring the Q's and A's as well as the chat. We're going to focus on the questions that were identified prior to this session, but as we did last time, we'll commit to any of the questions that were put into the Q&A in the chat. We will be following up and providing answers to folks as they go along. If we have time before the end of the session, we will try to address some of the questions, but given the amount of information that we have, we feel like we may be tight for time. So we're going to get started with a topic near and dear to most of us, pandemic pay. So we're going to ask Monika to speak from the AMO perspective. Monika, examining the list of positions and the interrelatedness of the approved locations, is there flexibility or risks to employment or employers for non-compliance or overextension of the application? What can you tell us about what we know from the province so far?
Okay, and thanks. I think I'll start with what we know and what we don't know, and the answer to the first question will reveal itself. So I'm talking about this because currently the province is still doing program design on pandemic pay. Even though it was announced by the Premier 2 weeks ago, they are not ready to go. If you check their website, it still has the page that gives some details for employees. There's no information there yet for employers, even though it says that employers, which are municipal governments, will be contacted by May 15th, which is only 2 days away. So what do we know? We know that it's 16 weeks, April 24th to August 13th. It's four-week chunks, 2 types. One is a temporary top-up of hourly wages for $4 an hour as a top-up, and second is a monthly lump sum, and you have to work at least 100 hours in a designated 4-week period. The province has told us so far that we'll probably get information about the temporary top-up before we get information about the lump sum, because the lump sum is more complicated. The employee is to receive the temporary hourly pandemic pay from your employer, but at this point we don't know how that will happen. And so I'm going to go now to the who. I'm going to do what, who, and how, and hopefully that answers as much as we can provide at this point. And I'll keep stressing, this is a provincial program. And so what we know from the municipal perspective is, unlike hospitals that only have to deal with the Ministry of Health, municipalities have the joy of dealing with 3 ministries and 4 different programs under this program. So it's the Ministry of Health, the Ministry of Long-Term Care, and the Ministry of Municipal Affairs and Housing. and these covered the 4 program areas of public health, paramedics, housing, which includes shelters and supportive housing, and long-term care. The biggest issue that I've heard from everybody is who is eligible. That is the big question. And if you're going to remember anything out of what I say on this, please let the province determine eligibility. If you get ahead of this program and start assuming from what little is written so far that so-and-so is eligible and someone else isn't, you're going to get ahead of it. And then when the program does come out and the province sets out the rules, you may have found out you've paid people that they don't think are qualified or eligible, and you know what will happen that way. So one of the things we know for sure is management is not going to be eligible, and everybody has tried to push on that every which way and such, because we all know that a lot of management, especially in long-term care, in public health, actually in all the areas, have been working on the front line. They've been holding a lot of the front line together. But the province has been very clear, management is not going to be part of it. That's the only clarity we have so far. We have been asking things such as under public health, if it's a public health nurse, is it a designation that you only get it if you are a nurse? Or if, say, you're a public health inspector and you've been redeployed to take the COVID lines to do that work of a nurse, are you qualified? We don't know those answers. Those are detailed questions that at some point the province is going to have to be able to clearly tell us who's eligible, who's not, for the program to run. And so the question of eligibility, but also how. Again, and this is my best information, haven't seen it written down, but I would do a good bet right now that it's going to be done through your transfer payment agreement. So if you're, so that's money on public health, your paramedics, so again, the silos. But what we have been doing in talking to all 3 ministries and 4 program areas is given the span for municipalities, please, please, please don't make us have different reporting mechanisms, don't have different templates, and don't have different processes for reconciliation. So we're asking for one identical template. We're pretty sure, even though they said they were going to do it integrated, we'll probably see it roll out per transfer agreements, but we're asking, unless they want the municipal sector to go mad, to just have one type of template, reporting, and reconciliation. And I want to stress the reconciliation, because I think what they're going to do is flow some money to the municipalities, but you're going to have to keep those records. You're going to have to see who's paid. And at some point, the audit function is going to happen where the province is going to say, and now we have to reconcile, and we don't think you should have paid X, Y, and Z. So that's why I say don't get ahead of this program. Let it roll out. It is going to be retro to April 24th, but we need those details. I've even been joking that we need a 1-800 phone number about eligibility. We need the province to answer that question, as opposed to putting municipal staff in that position, only to have maybe in 6 months' time the province saying, oh, we never meant that. So those are my comments. That's as much as we know at this point. There's still faint hope that we'll get something by Friday, just before a long weekend. If that happens, like everything else, AMO will shoot it out to everybody, but stay tuned. I think the details are going to come, and I think there's going to be a need for quite a few conversations about the province per program area about, did you mean X, did you mean Y? So Jane, that's as much as I know. I think I've covered all the questions.
Mm-hmm.
Okay.
Excellent. So maybe I would turn it over to Mark to hear what you've been hearing and some of the questions that may have already been raised with you and your colleagues.
Yeah, it's interesting. We first started out thinking that we were going to have answers by now. Obviously, we don't have those yet. What's become clear, I think as Monika said, is that management has been exempted. They've also said several helpful things to help us clarify that this is, at this point at least, looks like it's going to be non-pensionable earnings, not part of a base salary. Supposed to have no impact on benefits paid by employers. So I'm not exactly sure what that's going to mean in its entirety. It will only apply to hours that are actually worked, as opposed to sick time or vacation time as well. So there's parts to this that have been clarified, but for the most part, a lot of employers are still sitting out there asking the questions of, you know, I'm getting pressured a lot by the union or by employees. One area which is going to become very interesting, I think, is going to be what is the definition of management, because it is not entirely clear, especially within the world of EMS, where some of those lines might be drawn. So I think there's definitely some information that's needed yet. I saw something as recently as earlier this afternoon, Monika, that made me think that maybe this will be a broad net on the paramedics, as opposed to when you look at the website, it seems to potentially rule them out unless they're working in a hospital or in a long-term care facility. Of course, paramedics in Ontario are in and out of those facilities on a daily basis, which would become a tracking nightmare in terms of the hours. So it's a little bit unclear at this point, you know, whether they're going to meet that part of the eligibility requirement. There's the who and there's the where. They've said the who in terms of paramedics, but they haven't said how that necessarily rolls out. So it's kind of flip-flopped. It looked narrow at first without paramedics included, then it looked broad with paramedics included, and then the most recent document seems to designate certain workplaces. So at this point, we really don't know, and I think your best advice was to sit and wait on this. This isn't a matter of rushing out in front of it, and those employees who are eligible are going to get their money eventually. It is on top of their regular salaries, so it's not like they're losing salary as a result of this. So I think that patience, as hard as that is the best answer at this point.
Anybody else want to add any comments to what they're hearing as well? I don't know, Stephanie, if you might have something to add.
Mark covered everything that I was going to chime in on that. I think, you know, just echoing what Monika and Mark have said, just wait and see what happens, and hopefully we'll have some clarifications.
Awesome, thank you. So I think most of us are changing our frame of mind right now from response to recovery. And as we start putting together our recovery plans, I'm going to open this to Mark Ellis as well as to Lori Bolton. Perhaps you can talk about some of the obligations and guidelines that you're considering as you're putting together your recovery plan. And then we'll hand it over to some folks at Hicks who may have that. So Lori, why don't you start?
Okay, thanks, Jane. So I think everybody in every municipality is in the same situation. I think everybody looks to HR to say, okay, now what's the plan? We're ready to let's go. We're going to get the announcement, something more from Ford tomorrow, what's happening. So we have put together a team of staff to review everything that needs to be done in a staged approach. What we are considering first are our front counters at all our facilities with the plexiglass, and how are we going to serve customers. We actually, for a small municipality, we laid off over 50 full-time employees, including unionized employees, and then terminated contracts of over 120 employees. So for a small municipality, we have reduced our workforce significantly. So what we have now been doing is bringing back some employees as things evolve, such as, you know, cutting the grass in the parks or starting on Monday and things like that. So as we work through these issues, as everybody's in the same situation, we'll be addressing everything in a staged approach. as everybody else has done. Number of people working from home that have never done that before. In order to physical distance in the future, that's probably going to remain. You have to think about things like washroom stalls. Do you have to X off every other washroom stall? Do you put an in and out and some washrooms that only have 2 stalls? I mean, we do have some small facilities and some large facilities. You know, the arrows on the floors. You know, all these type of things that everybody is going to be considering. I think we all need to share with everybody what's happening, because everybody's going to be doing the same thing. Instead of recreating the wheel, we can all share what we're doing as we go. But like I said, our main priority in the next week or so will be looking at all of our customer service counters. What do we need to do to make them accessible and safe for the employee and the customer, and get that material on order. The other thing is, when we do have customers coming in, what is the assessment look like? Is that, you know, every standing at the door like they do at the bank? Is it filling out a form? So again, all these things have to be assessed that everybody has on their mind in a staged approach. So like I said, I do think we are really good at sharing things, and I think we need to all share and work together to assist everybody else rather than creating everything from scratch.
Thanks, Lori. Mark, anything to add? Mark Ellis?
Nothing much to add. We're doing exactly the same things. We're using the provincial guidelines as our guiding documents to ensure the safety of not only our employees, but customers as well. We're also splitting it up into 3 different buckets. So we have kind of the HR employee relations piece of it, which is really rooted in health and safety. And then the business recovery piece, which is dealing with the front-facing, resident-facing, client-facing aspects of recovery. And then we have the community piece. So we're addressing each bucket and in a staged approach, as Lori said.
Great. So maybe I'll ask Amanda what some of the big legal issues are that people need to be aware of. And then maybe Alex, you can weigh in from your perspective as well.
Yeah,
I'm sorry, do you like Alexandra or Alex?
Either one is fine. I answer to both.
Yeah, so I think Lori and Mark have identified some of the key kinds of issues, and there's a lot of things to talk about, and we're not going to be able to address them all today, just because, as you said, it's an ambitious agenda, and I don't want to take up all of everyone's time. But the key thing that I think both of them mentioned, and one of the things that's going to come up a lot as we start to move towards reintegration, is health and safety concerns, right? So I think Mark mentioned the provincial guidelines. And it's the Public Services Health and Safety Organization, I've learned the acronym at this point, that set out some specific guidelines for different organizations. So there's guidelines that exist specifically for municipalities, guidelines that exist in the context of office workers, and it specifically sets out some best practices for returning to the workplace. So things that Lori was talking about in terms of the plexiglass in the workplaces to block kind of access to customers. Another big thing is in terms of how you're going to organize your workspace, right? So are you going to have markings on floors that show where employees should be moving within the space? How are you going to set up office spaces, things that are communal? So for example, if you're a library and there's people who are going to be using a communal stapler, communal computers, how are you going to kind of adapt to that? So the health and safety components go into that a lot. And obviously when we're talking about health and safety, we're also talking about the potential of work refusals. So a lot of people moving into a return to work are anticipating an increased number of work refusals from employees. The work refusal process is set out in the Occupational Health and Safety Act, and it's very important to remember that there is a set process for responding, right? So there's obligations on employers to respond in a particular fashion, to involve the Joint Health and Safety Committee. Things may get elevated to having an investigator come in, or inspector come in, sorry, and do, I think now they're just doing over the phone inspections rather than actually having people come into the physical workplace, which makes sense. But there is an actual process that's set out in the legislation for dealing with these things, and as an employer, you have obligations to follow along with that. So that's something that you should be kind of mindful of, particularly when you have individuals who are raising issues of, I don't want to come into work, or I don't feel safe working without masks, or I need a screen, or all of these kinds of health and safety concerns that are going to potentially pop up. Another, I guess, big thing in the context of the work refusal kind of arena is this idea of people who are going to come
in and say, not be able to identify any specific thing in the workplace that's a problem or anything that needs to be changed, but are simply going to say, well, you know what, I'm afraid to come into work, or I don't want to come into work when COVID is happening, and how you react to those situations. And those are really kind of intricate issues that we're dealing with fairly regularly. In situations, again, where someone hasn't identified something about the workplace that you can change or improve, it may be that you get to the point where you're dealing with disciplinary issues, but those things are sensitive, and you should probably talk to either one of us on the screen or someone in our offices before you kind of proceed with those things. And then the other big kind of bucket that we talk about a lot when we talk about return obligations is obviously accommodation issues. And the two ones that we hear, or at least I hear mentioned most commonly, are the childcare obligations and then kind of the disability accommodations. So from a childcare perspective, as I'm sure all of you know, a lot of the daycares are going to remain closed longer than these orders are in place, closing some of our other buildings, right? So there may be situations in which people have to return to work, but their kids are still kind of blocked from daycares, and there's going to be enhanced kind of childcare accommodation issues that are going to come up. It's really easy in the context of COVID to assume that everything's different, and there are a lot of things that are different, but the accommodation process is still largely the same. So you would work with the individual to determine whether or not there's potential alternatives. So that may be exploring options for alternative scheduling, or whether or not there's work from home options, or potential childcare that can come from spouses or other family members. So again, you're just engaging in that kind of accommodation process from a childcare perspective. And then obviously, as I mentioned before, you may have employees who are immunocompromised and who, again, may be restricted from kind of coming into work as a result of that. There's also employees who may be pregnant and high risk as a result of that, and that may limit their ability to return to work. And again, you need to just ensure that you're engaging those accommodation measures and having conversations with those individuals to address those issues. Beyond those kind of two buckets, there's a bunch of other kind of small things that we often don't think about, but that are going to come up. I'll leave the privacy side of it to Alex to discuss, because she's going to have much more knowledge on that than I would ever pretend to have. But there are things, for example, around vacation. You may have people who didn't use their vacation while they were off, and now you have all this built up vacation that you have to deal with. You may have carryover issues that you have to address. Sick leave entitlements, again, people may have used up the bulk of their sick leave, and what's going to happen if people become sick when they get back or need to be off. And then also just kind of general policy issues. So fingers crossed that there is not a second wave of COVID, but we all understand that that may be a risk. And we all kind of, this round, we're scrambling a bit to put in place policies that adapted to that. And so we want to make sure that if there is a second wave, we have policies in place that allow us to kind of respond more smoothly. And then I guess the final thing before I pass it off, because I've definitely passed my 5-minute period or whatever I was given, is in terms of collective agreements kind of things. And Lori mentioned this, bringing back a lot of people who were on layoffs. You need to be really mindful of the fact that you're going to have collective agreement provisions that are going to kind of guide what you have to do, right? So you may have recall provisions that are being put in place. You may have loss of seniority issues. All those things are things you kind of need to be mindful of with your unionized employees. And so that's an important thing to keep in mind as well.
Okay,
and I'll
Alex,
pass it
over
off
to you.
Alex. Yeah, sorry.
So I would, in terms of policies, Amanda mentioned the importance of policies, and my public service announcement surrounds cyber hygiene. And I would say that this is a good opportunity for employers to be reviewing and updating their policies and procedures relating to information security and incident response plans. There is talk of a second wave, and with people working from home now and possibly in the future, that heightens the risk of cyber attacks. So bottom line, you should ensure that you're ready to respond in a case of a security incident. You might consider updating or implementing new security measures in order to protect the information in your workplace, like encrypting communications through a VPN, a virtual private network, implementing multi-factor authentication measures, periodic password resets, and consider whether or not your employees require any further education or training about working from home. You know, knowledge about how to, as best they can, identify phishing emails, for instance. Don't press that suspicious link. Don't be writing checks for $1 million, you know, stuff like that. So education might be a helpful thing to do in the circumstances now that we're coming back to work in anticipation that we may have to be working from home again.
Great, thank you. So one of the questions that we've had is, what can an employer mandatorily require from staff as we start thinking about recovery? Should employers be actively screening or building a process to return to work safely, and including mandatory testing when those who've been in self-isolation? What are some of the things people should consider from getting people back safely to work? So Alex, I think this is over to you.
Yes, so employers have a duty to keep their workplace safe, and depending on the circumstances, active screening may be required in order to achieve this, but it depends. For instance, I know active screening is now in the long-term care homes context. But it's important to check with your local health and safety and public health guidance on this issue. Employees should be told, based on public health guidance, when people should be isolating. Essentially, if employees should be self-isolating, they shouldn't be at work. Unfortunately, the Information and Privacy Commissioner has not provided any guidance with respect to screening and privacy concerns related to that. However, the messaging has been that privacy should not be a barrier during the course of a public health emergency that we're in. Some people are doing temperature checks, but this on its own is not, shouldn't be the sole screening mechanism to screen employees coming into the workplace. You might consider using the Ontario assessment tool. That's one way to screen employees. It has a very long, broad list of symptoms. So if employers or municipalities are considering alternatives, you may want to get an opinion from a qualified medical professional on the validity of any screening mechanisms that you might consider putting in place. But no matter what, privacy is a very important consideration in active screening. I mean, there's passive screening when we've got signs and stuff and wash your hands, but the active screening is pretty intrusive. There's no, with respect to non-union employees, there's no privacy legislation in Ontario that deals with employee privacies, which means it's a balancing act. And other jurisdictions do, like Alberta and BC, that can provide some guidance. But generally speaking, if the screening is reasonable and justified for health and safety purposes, it should be reasonable and justified for privacy risk purposes. So any active screening, you should be communicating with your employees about how you intend to collect and use and disclose their personal information, which means you'll want to notify employees about how you're going to collect their information and why you're doing it. You want to have a well-crafted purpose statement, the purpose for which you're collecting this personal information. And you should only collect enough personal information that is necessary to achieve the purpose of protecting the workplace. For privacy nerds, it's known as the data minimization principle. But the information should also not be used for any other purpose than determining whether an employee should be permitted to enter the workplace. You should also let your employees know the circumstances in which their information might be disclosed. So for instance, if there is a positive case in the workplace, you may need to disclose that information to others in order to provide a safe working environment. If, you know, to the extent possible, you would try and protect their identity, but there may be circumstances where their identity may be disclosed. If you do disclose, I think it's prudent for you to keep a disclosure record or log, you know, stating, you know, what information was disclosed, when it was disclosed, the date, why it was disclosed, just for risk management purposes. You want to keep any active screening records or these disclosure logs that I've just referred to separate from any other records in the workplace. This isn't stuff that should necessarily be in an employee file. This is again, an emergency exceptional circumstance that we're dealing with in this COVID world. So they should be kept separately, and they should be kept securely such that you know, only those that people who need to know should access them, but otherwise they should be kept securely so that no one should be able to access them. Think about how long you should retain those records. I mean, arguably it shouldn't be for forever. Again, the emergency hopefully will not be for much longer, but retention is something that you should be definitely thinking of. Have a point person, somebody that the employees can go to if they have questions about the information that you're collecting and keeping, and you know, have any questions with respect to screening. And just lastly, if you do have active screening protocols in place, you want to make sure that when you are doing the active screening, that you're doing it in the most private way possible. You don't want to, if you're screening someone, you don't want an employee, say, behind the line to be able to hear or gain any knowledge about what the results of that screening are. So that's something to keep in mind as well.
Awesome. I don't know, Catherine or Amanda, do you have anything you wanted to add?
I'll jump in just for a minute there. I just wanted to remind people in the audience who may be involved with Homes for the Aged that there are particular directives from the Chief Medical Officer of Health. And so in some cases, active screening is mandatory in accordance with that directive. So specifically for the long-term care homes, right now Directive 3 requires active screening for all visitors and staff other than emergency first responders. And that has to include twice daily symptom screening, including temperature checks. And it states that anyone showing signs or symptoms of COVID-19 should not be allowed to enter the long-term care home and must go home to self-isolate. And then the staff responsible for occupational health at the home have to follow up with those staff. And any essential visitors who are allowed to attend also have to be screened, including a temperature check. So these directives change. And they're updated periodically, so you just need to stay current on that, and they're all publicly available, and just make sure that for those who are involved with Homes for the Aged that they're complying with those.
Great. So while we're on the subject of long-term care facilities, a question has been submitted about whether or not we can require COVID tests for pre-employment in the long-term care facilities for those who are in essential roles. So I'm just wondering whether or not you have an opinion on this is something that employers can be doing, if this is a cautionary measure for them. So I don't know if Alex, you'd like to take that from the privacy perspective?
I think it's a bit problematic in terms of pre-employment. I think that active screening and protecting the workplace at the point of entry when employees are coming in is prudent, but if it's a precondition to the employment relationship, I think that it's problematic. Mark, do you have any?
Yeah, it's interesting because I frankly, I hadn't really thought of it too much, but obviously there's the privacy concerns, and Alex has talked about those in general, but it's kind of like in many ways, other pre-employment screening and tests, right? It's valid for the time when you're doing it, but especially with the speed at which things change in this COVID world, you're not really getting a meaningful test going forward. If you're talking about things like TB tests and immunization records, that's all valid as a condition of hire. But I think this is a little bit different. We also have to be very careful around human rights concerns, because you could end up in a scenario where prospective employees are considered to have a disability. Now, you're obviously going to argue that there's an undue hardship element to that, but there's a whole host of potential legal issues that probably go beyond the scope of what we can actually cover in a meaningful way today. All I'll say is it would provide you with a snapshot at a point in time, but there's privacy issues, there's human rights issues that are attached to that, and I'm not sure that the benefit is going to outweigh where you may end up going with it. The active screening is still going to be required on a day-to-day kind of basis. So I think that's probably going to be the saving grace in all of this.
Great.
Yeah, I'll just jump in there, Mark, too, is that there's right now the testing is done primarily by public health. So the employer may not even have the ability to send someone for a pre-employment test. So they can't just walk into public health and say, my employer says I need a test as pre-employment. So practically, you might not even be able to do that. There are guidelines that are, again, updated fairly regularly. The most recent one is from May 2nd, and that's the COVID-19 Ministry of Health Provincial Testing Guidelines. So right now, they're indicating that essential workers in long-term care homes, for example, if they're symptomatic, must go for testing. First responders, if they're symptomatic, but they're still not recommending that asymptomatic people be tested just on a regular basis. So there's resource considerations there, as well as the sort of legal issues that my colleagues have pointed out.
Thanks. So one of the favorite topics of conversations around a lot of HR areas is the use of masks, non-medical, as well as the N95. So the one question is, can the employer require, or should the employer require, the mandatory use of masks in their workplace? So Amanda, would you like to take this one?
Yeah, so I'll comment on workplaces more generally, and then I'll probably pass it off to Catherine to comment more specifically on the LTC side of things and some of the obligations that come out of Directive 3 and 5, and that kind of leads nicely into the next topic, not to spoil it for anyone who's listening. But in terms of kind of the non-LTC workplaces and mandatory masks, I'm going to bring you back to the directives that I talked about at the beginning. So those are the Public Services Health and Safety Organization directives. And they set out, like I said, kind of best practices. And if you look through the guidelines, you'll kind of repeatedly see that PPE is usually kind of at the bottom, right? So generally what public health kind of seems to be saying is, if you can't do social distancing and you can't put these other measures in place in your workplace, then PPE might be the way to kind of do it. And as you identified, Jane, you would be dealing with non-surgical masks. But there isn't currently directives from public health or from the ministry that say that all workplaces should be implementing mandatory mask kind of policies. And I think generally the focus should be on some of the other things that you can do to alter your workplace to kind of help protect individuals. So again, like having proper social distancing, making sure that same people aren't using the same equipment, the plexiglass, all the things that we've already kind of talked about. And then the other thing to kind of keep in mind, and even if you did want to implement a mandatory policy, again, which doesn't seem to be something that's really supported by public health at this point, there's other issues that are going to pop up, right? So all of us know about the supply shortages with masks, right? So if you're going to implement a mandatory policy and you're going to say everyone who comes to work has to wear a mask, you're going to be responsible for providing those masks. So where are you going to get them, right? I don't know if you have someone who's going to sew masks for everyone, in which case, I mean, that's fortunate, but there are supply issues that you have to be kind of mindful of. And the important thing to keep in mind is, just because you don't have a mandatory mask policy doesn't mean that people can't wear masks, right? So going back to some of the stuff we talked about at the beginning with health and safety and work refusals, there may be employees who feel more comfortable coming into work if they can wear PPE. So it may be gloves, it may be masks, and you may be comfortable allowing them to do that. And not having a mandatory policy doesn't mean that you can't allow for that. It's just there's a difference between requiring everyone to do it at all times and kind of making an allowance for it in specific kind of exceptional circumstances. And obviously there may be specific things about individual workplaces that warrant heightened use of PPE, and we can't comment on these now kind of more generally, but as a general rule, the mandatory use of masks hasn't been something that's been widely supported. So I'll turn it over to Catherine to comment on some of the LTC side of it.
Okay, so I'll talk a little bit about the masks, but at the same time, I'll talk about the other question that we had, which was about the implications in the Stout arbitration award, because of course that relates heavily to masks. And so we'll kill two birds with one stone here. So in terms of backdrop, as you know, there's directives from the ministry, from the Chief Medical Officer of Health. Directives 3 and Directives 5 were primarily at issue with respect to the Stout Award. Long-term care homes and hospitals, but for this group we'll focus on the long-term care homes, are obligated to comply not only with their directives, but also with the Occupational Health and Safety Act, of course. Section 25, numerous other sections, but Section 25 is the one that says, you know, an employer shall take all precautions reasonable in the circumstances. So to understand sort of what led to the Stout Award, the prevailing approach from the Ministry of Health, Public Health, World Health Organization, et cetera, is that COVID-19 is primarily protected by the use of droplet precautions. So although there is competing sort of medical opinion on this, generally the prevailing view at the times right now seems to be that it is not airborne. It is instead transmitted through droplets. So the directives 3 and 5, have put forward that as COVID-19 is not a virus requiring airborne precautions, the routine use of what's called an N95 respirator is not required, except when somebody, a patient or a resident, is undergoing what's called an aerosol generating medical procedure, so an AGMP for short, in which case the healthcare worker, the person administering the treatment, et cetera, should wear airborne precautions, which include an N95. So for other circumstances, the directives indicate that droplet precautions, and droplet precautions mean a surgical mask, goggles, gloves, gown, face shield. So it's not that you're not wearing PPE, it's just that it's not, it doesn't involve a respirator. So Directive 5 was amended and also came about as a result of input from several unions, including the Ontario Nurses Association. What came out of Directive 5 was that every healthcare worker, and so that doesn't include your PSWs, it only includes your regulated health professionals like RNs or RPNs. Every healthcare worker must perform what's called a point of care risk assessment. So a PCRA is what you'll hear people talking about. And they're supposed to do this PCRA before every patient or resident interaction in a hospital or long-term care home. And if that regulated health professional determines, based on that PCRA and based on their professional and clinical judgment, that certain health and safety measures, such as an N95, might be required in the delivery of care to that resident in the home, then the long-term care home must not unreasonably deny access to that appropriate PPE. Directive 5 also says that at a minimum, N95 respirators should be used when someone is administering the AGMPs, and there's a whole list of those. And that droplet precautions should be used at a minimum, which is no N95, but everything else that I mentioned, when you're dealing with the suspected, presumed, or COVID patient, but you're not doing an AGMP. So what happened that led to the Stout Award is that the Ontario Nurses Association sought an injunction from the Superior Court of Justice on an urgent, expedited basis. And the respondents to that were several long-term care homes, as well as the Ministry of Health intervened and the Ministry of Labor. So Justice Morgan was faced with some competing medical evidence and a huge volume of material, and ultimately gave ONA, awarded ONA the interim relief that they were looking for, and ordered that the homes must comply with Directives 3 and Directives 5. And it's important to understand that the homes claimed that they were, of course, doing that. But the debate was about sort of how to interpret that. So Justice Morgan's decision said, long-term care homes, you must provide the nurses with access to fitted N95, so they have to be fitted, N95 facial respirators, and any other appropriate PPE when it's assessed by the nurse at a point of care to be appropriate. So the nurse is not restricted to AGMPs. If the nurse does perform his or her PCRA and determines that an N95 is necessary, then the long-term care homes were directed not to impede or hinder the nurse in getting that PPE at the time. And so, of course, one of the issues, as we know, is that N95s are in short supply around the world. And so Directive 5 also talks about both the healthcare worker and the long-term care home must engage in conservation and appropriate stewardship with respect to the use and storage of these N95s. So at the same time, the very next day, the Morgan Award was April 23rd. The very next day, the Ontario Labour Relations Board issued a consent award, also dealing with multiple long-term care homes, but with respect to a different union, SEIU, and made very similar orders, overlapping orders really, to Justice Morgan. And it was a consent award, but so the vice chair did assume jurisdiction in that. And it outlined some other issues about, for example, the Ministry of Labor inspectors would attend on a weekly basis in person, which of course they haven't been doing very much. It's mainly been phone investigations to these long-term care homes to make sure that the PPE is being properly utilized, etc. So the Morgan Superior Court injunction was only interim. It was supposed to be dealt with on an expedited arbitration basis, which it was then quickly dealt with by arbitrator John Stout. So that award technically is not binding on anyone other than the parties. It is an arbitration award, of course. So long-term care homes that are not a party to that would not be bound by the Stout Award. But nonetheless, the Ministry of Labor has been taking the position that Justice Morgan and Justice Stout's interpretation is the one that they will be relying on when they conduct inspections or when they answer Ministry of Labor complaints. And what we've seen from that recently is many unions calling the Ministry of Labor, having an inspector in. If the inspector doesn't issue the orders related to the pandemic that they believe to be appropriate, then they are appealing it to the Ontario Labour Relations Board through what's called a Section 61 appeal. So it's not only ONA, there's multiple unions doing this now. And what's flowing from the Stout Award and the Morgan Award and the Ontario Labour Relations Board is that healthcare workers are not to be, they believe they're not to be impeded with respect to accessing that N95. They have to be readily accessible. If they're stored in a secure location, can they get at it quickly, etc. So we're seeing complaints about even the interpretation of that and the communication as well as education and training given to nurses about what their PCRA ought to take into consideration. So we anticipate that more of that will be forthcoming. The other thing to be aware of is that after these decisions were implemented, the public health put forward additional documents to provide some guidance, and that was on May 10th, and that's actually quite helpful. It talks much more specifically about when N95s ought to be used and provides clarification. So for example, there's a specific page in those guidelines that says for those healthcare workers who are swabbing staff or residents to test for COVID, that they don't need an N95 for that. So they're testing somebody who's suspected, they're putting a swab in the mouth, but that normal PPE, including a mask and a face shield. Keep in mind, all the long-term care homes have moved to that, of course. So there's surgical, they're all given a minimum of 2 surgical masks. Then they have their face shield, 3D printed, fitted face shield that they get to keep, gloves, isolation gown, etc. So that is the current situation with respect to N95s and the use of PPE and masking as it relates to healthcare facilities in a nutshell. I've tried to be very concise, but there's a lot of information in there.
Thank you, that was awesome. So looking at the new world that we're going to be living in, I'm going to throw open a general question very soon. But one of the questions a lot of people are talking about is, if we're going to have work from home on an ongoing basis, the validity and whether or not they're binding of contracts between employers and employees on work from home arrangements. So what's your recommendation and what are the concerns that people should watch for? And I'm going to ask Mark to take the lead on that one.
Sure, I'm just going to be brief on this because I think I'm interested in hearing what Mark, Ellis, and Lori have to say on this as well. But the reality is, you know, the new world is going to dictate new things, and you know, typically we've always been of the view that changing to a different contract of employment mid-employment is a little bit difficult and has some legal ramifications if you're not offering fresh consideration. But in this case, you know, when you're completely changing, or at least on a temporary basis, the employment arrangement, and I don't think a lot of employees are going to fight you on this if you're allowing them to stay and work from home. There's various, you know, OC Health, WSIB, safe workplace issues that you are going to have to work through, which may involve, you know, commitments from the employees with respect to their workplaces, what they look like, maybe it's a picture taken, and, you know, inspection, various things that may get you there on that. But there's no reason that these can't be valid agreements, provided that you dot all the I's and you cross the T's on those. I don't know if Lori and Mark, whether you guys have started down that path yet or not.
We started looking at the new normal and what that would look like, what that would mean. So we're looking at our work from home policies, because the ones we had in place before obviously wouldn't address the new state. They were meant for really temporary issues where it was an accommodation for an employee for a day or maybe a week, or nothing in duration as to what we have or what we're contemplating now. So that conversation has started, and we're looking at the WSIB issues, the health and safety issues. We're also looking at the productivity side of it, and how do we ensure that the productivity levels are maintained and not reduced during that same period. So there's a lot of conversation right now. The other big point that we're talking about is what Alex brought up earlier, was the privacy piece, the phishing scams, the IT technology, and how do we ensure security of our information, safety of our employee, and then productivity. As those are kind of the three big buckets that are floating around.
Lori, do you want to add?
And I agree with everything that Mark said, and I think we're all having the same conversations because this is all happening so quickly. One thing we are looking at as well is a form that you maybe fill out at the end of every week, documenting what you've done and submitting it to your supervisor, so that we can ensure that you're putting in a full week at home. Again, those are all conversations that are occurring. And like Mark Mason said, picture of your workplace so that we can ensure that it's ergonomically correct, and that we can prove to the Ministry of Labor we know where everybody is working and what their workspace looks like, and we're not sitting on a stool on the ground or whatever. So yes, we're the same as Mark. Ellis is having those conversations, and they haven't been complete, but those are all the things that have to be considered.
One thing that I'll say here, and this kind of applies to a bunch of this.
Mark, you're kind of quiet.
Oh, maybe I just got to move closer. One thing I'll say on this, and this applies to a bunch of the things that we've been talking about, is the fact that, you know, templates and you know, model agreements that you can get from others, just be very cautious in terms of how you're using them, and be very careful to go through them and make sure it is specific to your workplace, because there can be some significant differences that can really vary from site to site. And the other thing I'll say is, based on my experience, it's interesting the concern that we have around productivity. I'm going to suggest to you that the new world may actually lead to higher productivity than what we currently have, because I think we're in a much more heightened awareness around that than we might otherwise be.
Great. So we probably have time for about one more question. So I'm going to open it up largely to Mark, Ellis, and Lori. Just questioning what you think some of the things to consider about the new normal in HR are going to be. So we've talked a little bit about the work from home pieces. Are there other things that you think are going to change in the workplace? And this may be cannon fodder for another session, given that we have 15 questions we haven't been able to get to, but we will respond to them. Do you think that there are elements of the new normal that people should be focused on or considering as we move forward?
Okay, I think right now what's one of the top things that everyone's considering is hiring of summer student and contracts. So the government was supposed to have provided us with our summer grants program as of last Thursday, May 7th. I was advised that we're supposed to be provided something today, which I have not received. So I think for the 100% funding. So I think that's going to have a big impact on moving forward, because a lot of us already have some of our full-time employees laid off, and we have committed not to bring back any part-time contracts or summer students until we bring back all of our full-time. So there's many different aspects to that, not only for your summer students that you've hired for the last 5 years and their financial implications, but however, moving forward, I'm not sure what the new normal in quotes looks like. If this is going to, you think of our Parks and Rec summer programming, is that going to occur this year? We are still having those conversations. Many municipalities have canceled theirs. We are one of the larger municipalities in our area, and because the smaller township have canceled, we're trying to see if we can accommodate, because everyone's going to need childcare. So again, this is what does the new normal look like? And if you do have that, how do you physical distance? How do you ensure children are not rubbing up against each other? The washroom situation. There's so many things we are considering right now into what we call the new normal. So I think those two things moving forward are top of mind for us, is that we feel really challenged in our, over 100 students. And again, we're a small municipality. I can only imagine what larger municipalities are going through, is that, you feel empathy for these students trying to find jobs, but you also feel empathy for our full-time employees that have been laid off.
Awesome. Mark, Ellis, anything from you?
Much along the same lines as Lori. I think my hesitation about the new normal is we don't know that it's going to be normalized. We don't know when normalization is going to happen. We don't know what time frame we're talking about. So heightened safety measures may be here forever. They may be here for a year or two with regards to social distancing and others. So right now, to say the new normal, I don't think it's fair to use that term. I think what we need to do is look at what risks are present in the workplace, what risks our employees are providing us information on, what the union's identifying, what the province is identifying, and look to address those in a systematic fashion whereby we can still ensure the needs of the residents in our communities are met, while at the same time ensuring the health and safety of our employees while they produce work to meet those needs.
Great. I don't know if any of our other panelists would like to add for different things that we think people should focus on as we start contemplating what the environment looks like for the next little bit.
A big issue is just continuing to communicate. And Lori and Mark, I'm sure that you have been doing a ton of that recently and would have more to say on that. But I think that helps both from a legal perspective and from a human resources perspective, just continuing to communicate with your employees, keeping them advised on where you're at. And that way, I think the more information that people know, it helps with some of the anxiety that everyone is feeling, some of the uncertainty, and can help to ease people back into that transition. So if they know what your plans are in advance, that can help as well.
Okay. So we are at 3:30 or 4:30, 3:30 I wish. But I would like to thank all of our panelists for today. As I said, we will get back to everybody on the Q's and A's that were provided, and we'll do our best to get those out as expeditiously as possible. Thanks so much for attending this session. I think it's really important that we continue to have the partnership between Hicks Morley, AMO, and OMHRA as we forge ahead with the different human resources issues that we've got. I'd like to thank both of our board members, because Mark is also a board member from OMHRA, both Lori and Mark, for participating today, and as always, our colleagues from Hicks with all of their wisdom. So thanks so much, and we hope to see everyone soon, and until then, please stay well. Bye.